try to space this out, it never works. So you're likely going to come in and wait, you know, if your time's like 11 o'clock, you're likely going to wait, and it'll be later than that. Because somebody ahead of you is likely to take extra time or something like that. So just be prepared, you know. Doesn't mean, just because your time is 10 o'clock or 11 o'clock doesn't mean we're actually going to start at that moment, at that time. So there's going to be 10 patients. This one's our practice patient, Dolly Parton. It's going to be 10 patients. It'll be laying on the table here, upside down. And you're going to come along and you're going to randomly pick one of these 10 patients. And then you're going to read the story. And here's Dolly Parton's story. Parton's a 64-year-old female who's admitted with abdominal pain for 4 days. She has intermittent nausea and vomiting and is now presenting with a fever of 101.4. She has a history of diabetes, hypertension, GERD. It lists her vital signs for the morning, and it says her blood glucose was 255. Prepare and administer Miss Parton's 8 and 9 o'clock medications. So I'll give them both at the same time. Okay, so we're going to do that. Next thing we're going to do is we're going to go find her order sheet, and the order sheet will be in a binder like this. She's going to go through, find hers, and take it out of the binder. And let me see if I can, here's an order sheet right here. So you're going to take the order sheet, and you're also going to take this sheet. You're going to find the one that's for Dolly Parton, and you're going to take this sheet out. This is her medication administration record, okay, MAR. So you're going to take those, you're going to put the story down, and you're going to look and make sure that the order sheet matches the MAR, or the MAR matches the order sheet, really. So you're going to, so cardizem 60 milligrams PO daily, hold if heart rate is less than 60. And the first thing says cardizem 60 milligrams PO daily, hold if heart rate is less than 60. The next one says lisinopril 10 milligram PO daily, hold if systolic blood pressure is less than 100. And this says the same thing over here. You're just going to check and make sure that this is correct. Okay? And then you're going to, you don't need this anymore. You could put it back in the binder, or you can just keep it with you if you think you might need it. There's no reason why you wouldn't need it, but so that's fine. So now we're going to work off of the MAR, okay? And so we're going to go and get a metal tray. We're going to find a drawer that says Dolly Parton, and there's drawers on both sides of the cart. So your patient's drawer, whether, you know, if it's Jane Smith, could be on either side of the cart. So I'm going to just take a drawer. Now Dolly has five or six drawers here, so for you to practice with. So we're going to do that, and then we're going to work off the MAR. So while I'm over here, I'm going to get a drinking cup, and I'm going to get medicine cup. It's best just to use these kind, because the pills will fit in those better. These are the kind you usually put pills in, the paper ones, but, and these ones are usually for liquid, but those aren't very big, so it's going to be hard to get your pills in there. So now work from top to bottom. Don't go reach in here and say lisinopril. Okay, there's lisinopril. I'll put that in, because if you bounce around, you're going to miss something. So just work systematically from top to bottom here, okay? So start with cardizem, 60 milligrams, and look in here until you see a cardizem 60 milligrams, and there's one right here, okay? Now, these little packages, these are made to be fake medications, just so you know. So it says Cardi, C-A-R-D-I. They always misspell the medication because they don't want people to think that these are actually real medicines, okay? So it's Cardi or cardizem. So, okay, and it's 60 milligrams, 60 milligrams. Hold if heart rate is less than 60. I can go back to my little list here and I can see my vital signs. Heart rate's 94. So I'm going to give that medicine, right?
Does this count as your second check?
No, that counts as your first check.
Okay.
Okay? Got it?
Yep.
Okay. Then the next on the list is lisinopril, and there's my lisinopril. I check to make sure the dose is right. Remember my 5 rights. Check and make sure the dose is the correct dose. It's 10 milligrams, 10 milligrams. Okay. Next is Humalog insulin sliding scale. Oh, so her first blood sugar, when you check it, you check them 4 times a day for corrective insulin. Remember that? three kinds of insulin: basilar insulin, prandial insulin, which is mealtime insulin, right? And the third one is correction insulin. So it says for blood sugar between 150 and 200, I'm going to give 2 units. Blood sugar between 201 and 250, I'm going to give 4 units of Humalog insulin. For blood sugar, 6 units for between 251 and 300, and 8 units for 301 to 350, okay? If it were higher than that, you're going to call the doctor. Okay, so this is coverage, but if it's higher than that, the doctor really needs to know about it. And so you get to call him and he'll find out what he wants you to do, he or she wants you to do. So your blood sugar is 255, so that means you're going to give 251 to 300, which is 6 units of insulin, okay? We usually have in hospitals U100 syringes. These other smaller syringes, like ones with just 30 units in it, 30 units here equals 30 units here, by the way, okay? It's a bigger syringe. These are usually used in pediatrics when they might even get like 2.5 units. And it's really hard to do a half on this. So I'm gonna get my syringe, and in here I actually happen to have Humalog insulin. So I'll put that out for later, okay? And I'm ready to go with that, okay? Yeah, if I didn't have the insulin in my drawer, some drawers have it, some drawers don't have it, I'm going to go to the pharmacist. There's going to be a pharmacist over in our medicine room. It's going to be one of our seniors, okay? That's going to play pharmacist for us. And you find out get what you need from them. Yeah, question.
So for the syringe, should we get the 100 unit for it? Or?
Yes.
Okay.
Yes. Okay? And then Compazine, 10 milligrams PO. It's Q6 hours PRN for nausea and vomiting. I go back to my story. It says she had nausea and vomiting a few days ago, but it doesn't say anything about having nausea and vomiting now. So what could I do? I could ask her when I go into the room, right? So maybe I'll do that and see if she needs something, okay? And then it's Tylenol, 650 milligrams, Q4 hours PRN for temperature greater than 101. What's her temperature?
101.4.
No, that's what it was when she came in. It's actually 102 if you look at her vital signs here. But that's from the story when she came in, or earlier it was 101, but now it's 102, so she still gets them, right? So I find my Tylenol, and there are a couple Tylenol here, and they're marked on them. Whoever did, oh no, these actually match. There's another drawer where they are completely different colors, but they both say Tylenol. So now there's my Tylenol. So now, as I take it out of the drawer and as I find everything, that's my first check, okay? So now, I'm going to do my second check. So I go back to the Cardizem, and my second check, I'll find my Cardizem, Cardi, and now here we're not going to really open the package, but normally I would tear the package open, get the pill out, and I would put the pill in the cup, and that would be my second check. And the way I do a third check is I then, before I discard the package, I will look at it one last time and read it again. So that's how I do my third check. Now some people say you need to do your third check at the bedside. I don't do it that way. So you could say I'd either check it before I discard my package, or I'd check it before I give the medications to the patient. Check it again, okay? You could even say that's because that's how Dr. Antinone said to do it. Okay, and the next pill is going to be my lisinopril. So I'm look at my lisinopril, 10 milligrams. Same thing. I'm going to open the package. I said that's right. That's exactly the right medicine. Open the package, put it in the cup, and then I'm going to look at it again before I discard the package. And the next medicine is the insulin. So I'm going to just skip that. The Compazine here we're not going to give. The Tylenol we are going to give, and I have 2 tablets. They're both 325 milligrams each. Yes.
So when we do it tomorrow, we're not opening them.
We're not opening them. Just like I'm not opening them now. Okay? We're not going to open them. We're just going to say we opened them. And she's not going to swallow them because I've never seen her swallow anything. Okay? So 325 equals 650. That's the right dose. So now I'm going to put those pills in the cup, and I'm going to look again before I discard these to make sure I have the right medicine. And it's, you know, it's just a good habit to do 3 checks. And there's been times, you know, you're working 12-hour shifts, you're going to be tired, you know, you go and get a pill, and you reach for the wrong one, and you get to, sometimes you get to that 3rd check, and it's like, oh, wait a minute, let me look at that order again, or something. So, I mean, it's happened to me, not often, but it will happen at some point in your life that you'll be saved by your 3 checks from making a mistake. So it's got to become a habit. It's got to be like, that's the way I do it. That's what we're trying to tell you. Safety things have to become a habit. They have to be, you have to do them like that all the time. So now I'm going to look at this guy, human log insulin, 100 units per milliliter. And this has 100 units per milliliter. I'm going to give 6 units. It goes, 6 units does not mean 60. 6 units is up here less than 1, so it's just a little bit of insulin. And so each line is going to be 2 units. So I'm going to actually just come down 3 lines with this. So I'm going to take my alcohol wipe. This is my alcohol wipe for now. And I'm going to clean the top of my Humalog insulin. And then I'm going to take that cap off of the plunger end. I'm going to take this cap off. I'll lay it down so I can recap it because I'm doing it out here. Now I'm going to I'm going to actually pull back about 6 units, and I'm going to push that into the stopper. I'm going to inject the air, and then I'm going to pull back. I always pull back farther than I need to, so I may pull all the way back to 1, and that way, that's because often you'll get an air bubble in there, so that makes it easy to get the air bubble out. So I pull back to 1, and I push up to 6. So this is a double check medication, right? So that means 2 nurses have to look at it to make sure it's the right dose. Okay? So you always want to know. And somebody yesterday, I came in, and somebody told them the right dose was go down to the 6. So that would have been 60 units and not 6 units, which might have killed somebody. Okay? So now we're going to do a double check. Does that look like 6 units?
Yeah, it was perfect.
Does that look like 6 units?
Yes.
6 units?
Mm-hmm.
Okay, so you can see it's not, 6 units is not a lot. Okay? Got it? Everybody got it? 6 units? 6 units? 6 units, okay? Now, I'm going to recap. The correct way to recap is not to do that, but to put your needle in there. You have to be careful doing that so that you don't contaminate your needle. You put your needle in there and then pick it up and then put the cap on. Okay? Now, it wouldn't be so bad if you stuck yourself because it's a sterile needle. So you just have a hole there at this point when you're doing that. But you know, it just hurts when you stick yourself. So don't do it. So, and if you would stick yourself and accidentally inject insulin in yourself, what would you do?
Report it.
Huh? Well, you could, but it's not going to kill you. Okay? What would happen if your body released a little extra insulin? Then your liver is going to release a little extra sugar. Okay? That's if your liver has enough sugar left in it. So I wouldn't trust that. I would go and eat some candy or something like that to add some other extra sugar to my body too. But most likely, with 6 units, there's plenty of sugar left in your liver. Usually your sugar holds enough liver for sugar. Your liver holds enough sugar for 24 hours, usually. Okay? So so there's usually plenty in there, so that you're not gonna. And even if you would give like your patient an extra unit of insulin, it's not going to kill them because they have a liver too that's going to raise their sugar back up. Okay, it's when they get insulin and they don't have any sugar left in their liver. That's when, because maybe they've been vomiting for 24 hours or something. That's when they're in danger of going into, you know, going into shock? Yeah, they call it diabetic shock,
Yeah.
that's what they call it sometimes. That's when they're in danger of being hypoglycemic and becoming unconscious or becoming confused. Yes.
When we're double checking the insulin tomorrow, do we ask?
Just turn to the instructor who's doing it, let them see it, okay? Got it? Just say, this is a double check medication, okay? Now, I got asked a question yesterday that nobody's ever asked me before, and I can't believe nobody's ever asked before because it was such a good question. But they were like, I don't know what these medicines are. I don't know what lisinopril is. I don't know what, should I look them up before I give them? And, well, technically, in real life, you should. I mean, we're not gonna ask, you don't have to know them for tomorrow. We're not expecting that you know them for tomorrow. But if you would say, while you're doing this, you'd say, and I don't know what lisinopril is, so before I give this medication, I'm gonna look it up. Now, there's medicine books there. You don't have to look it up. The instructor's just gonna say, okay, pretend you do know what it is and just go on, right? You don't have to look it up, but that's such a good thing to say. They're gonna think you are so smart and you are so good that they might give you a break somewhere else if maybe you're about to make a mistake or something. So just think of that. That's really a good thing. And it's like, I can't believe nobody, I've been doing this for years and I can't believe nobody's ever came up with that. Like, I don't know what this medicine is, right? So, but if you're in the hospital, you're gonna look everything up before you give it. There's a medicine called Unison. It's an antibiotic, okay? And it's a type of penicillin. So if you tell your patient, I'm gonna give you Unison, if you don't know what Unison is, if they're allergic to penicillin, you would never know it, right? If you don't know what it is. But you would see right on their name bracelet, right on their chart, that they're allergic to penicillin. Okay? Does that make sense? So things can have names that don't tell you exactly what they are. Okay, well that's pretty good. We got our insulin ready. So you usually give your medicines in the order of least invasive to most invasive. So least invasive is going to be something that they put in their mouth and they swallow with a sip of water. And the next least invasive is going to be a liquid, if there's a liquid medication. There could be. And usually that's going to be in the stock drawer down at the bottom. You know about that, right? So if you're looking for mocha magnesia or some other one, that you're going to find them down here in the stock medicine drawer. Okay? And you're going to take it out, and if it says 1 tablespoon, how much of a cup is that going to be? How much of one of these medicine cups?
15 milliliters.
Huh?
15 milliliters.
15, and how much is in a cup? 30, it's 1 ounce, right? 1 fluid ounce, 30 milliliters. So I'd give half of the cup. Remember, you're gonna pour it until you see the meniscus get to that 15, right? Okay. Got it? So that could happen too, where you could be giving and you are actually gonna pour a liquid medication into the cup. Now we may just pour it right back into the stock bottle, but you are just gonna pour it in, you are gonna pour it, okay? So now it's time to go find Dolly Parton, right? And I know Dolly Parton's room is right over here. Now any of these tomorrow can be Dolly Parton, be your patient.
Even
Okay.
the kid?
Huh?
Even the kid?
If we need them.
Oh.
If we need to. Okay? So we'll be several of us. So if somebody's here, if I like to use this patient, but if somebody else is over there giving medicine to that patient, then we're gonna go to some other bed. We're just gonna move. But anyway, right now, Sunshine here is my best Dolly Parton. So what am I gonna do when I get over here? Huh? Your what? Yeah, you're actually gonna wash your hands before you prepare your medicines. I just thought of that. I didn't tell you that in the beginning. But you should come in, and the first thing you tell me is I'm gonna wash my hands. Like after you get, as you start getting your medicine ready. So don't forget that. Now, so I'm gonna look at her name band, right? And I'm gonna see who she is, right? And the name band might say something different. We just wanna so don't worry if it doesn't say your patient's name, because there's 10 different patients, okay? So it might say something different, but I just want to see you checking the name band. And okay, And now you're gonna pretend to give the medicine. Here's your medicine dolly. And next, if you had a liquid medicine, you're gonna say, here's your medicine, and do that. And you can give her a sip of this pretend water. And now it's time for us to give her her insulin. So we're gonna give her insulin on our favorite little dummies here. And so we're gonna take this, and we're gonna take my alcohol wipe, and I'm going to give the insulin. Insulin we're gonna give in the abdomen, which is two finger breaths away from the umbilicus, right? Right? And if you say belly button, it's still okay, but I will make fun of you. Okay? So now I know what needs. So now I'm going to say, okay, let's give it right here. And ideally we want to rotate our sites. So we'll give one like here, one here, one here, you know, and not in the same spot every time that we give it. And we're going to clean that area. I'm going to take the cap off, and I'm going to take my insulin, and I'm going to inject that. And these needles are like to bend, and I'm going to, do I aspirate on a sub-Q injection?
No.
I don't have to aspirate, so I'm going to inject my insulin, and then I'm going to pull that out, and now I've given my insulin shot, right? Am I going to recap that?
No.
Technically, I've got a Sharps box right there, so I shouldn't be recapping. I should just put this just like this into a Sharps box, okay? However, we are going to reuse these and keep using them over and over again until we bend the needle. So, if we don't bend the needle giving that shot, then we are going to just put it back in so we can use it. That's just one way we like to save money in our sim lab, so that we can keep doing that, okay? So, couple things to remember here. What happens if you don't have a medicine in your drawer if it's missing?
Pharmacist.
What?
Pharmacist.
Yeah, you fill in this little slip of paper though, right? Fill in this little slip of paper, and it says patient name, room number, medication, write it out, name, dosage, route, frequency, requested by, co-signed by your instructor, and then you're going to take it over to the pharmacist, right? Are you just going to walk over to the pharmacist who's standing there? No, you're not, because you have medicines out here on a tray. So you're going to turn to your instructor and you're going to say, I wouldn't leave my tray, so will you watch it while I go to the while I go to the pharmacy and get the medication? And your instructor will say, I sure will. And thanks. So remember, you don't walk away from your tray. I'm not going to walk away from my tray and say, hey Dolly, are you nauseous today? I'm not going to do that either. Okay, those little mistakes like that can get you. I told you the story about the one student. So yeah. So okay, so that's something to remember. Remember where your stock medications are. Remember you don't walk away from it. Remember to wash your hands before you start getting the medicines ready. And yes.
So you said that each of our patients will be some sort of injection. So if like our patient has insulin, would we not do? Will some of them have like insulin and some will have IM injections? Or could you have both?
Yeah, some will have IM injections, or they could have both. Okay, and if you want to practice your IM injections while you're doing Dolly, we actually have a liquid compazine that you could give, so nausea medicine. It's actually written as prochlorperazine. That's the generic name for compazine. So if you wanted to give her a milliliter of this just to practice with, you're welcome to do that, yes.
Will the room number be on like the patient sheet so we know what to put on the form?
Bed
Or
one.
is it, okay, so just do the bed
Bed
instead
two.
of the room number.
Okay?
Okay.
Just say bed one, bed two. Those are our room numbers.
Okay.
Did you see our little slogan for our sim hospital? Have you ever looked at the sign? It says Franciscan University Sim Hospital. Our life's work is life itself. Yes.
So, if we have to give a medicine through the feeding tube, will it be on the order that it can or cannot be crushed, or we need to look that up ourselves?
You need to look that up.
Okay.
but we aren't gonna give any meds through the feeding tube,
Okay.
Nice.
okay?
Are there respiratory meds that we would
There
give?
could be,
Good to know.
okay?
Yep.
Anything like that's fair game. Mhm.
So when we use like an insulin pen, we're supposed to wait 10 seconds before we take it out?
You're supposed to wait a little bit, I guess.
Okay, is that only with the pen though? We don't need to do it with the syringe?
No. And we won't be using the pen.
Okay.
It'll all be with the syringe, any insulins that you give. Next question?
Do you wanna demonstrate an IM shot for us?
You want me to? Really?
Yeah.
Okay,
You're
I'll be happy to. You want me to use an ampule or you want me to use a?
ampule.
Okay, let's use an ampule. Let me find a syringe.